A dementia care plan should not only live in one caregiver's head. Hi, I'm Debbie Callender, founder of Care Caribbean Online Communities. Today we're going to take a look at dementia care plans and what should be included in them. So here's a summary of what you need to know. A good dementia care plan should include the daily routine, medications and appointments, the safety risks, personal care needs, what upsets the person, what helps to calm them, emergency contacts, and who is responsible for what. If only one person knows all of that, the care system is fragile. So today, we're talking about what should actually be in a dementia care plan. So, a dementia care plan is not only a medical document, it is the practical plan for daily life with a person living with dementia. It helps the family to know what needs to happen, who is doing what, and what to do when something changes. In many families, one caregiver holds everything in their head. They know the medication, the doctor's number, the time that the person usually wakes up, which cup the person prefers, what makes the person upset, how to get them into the bath, what to say when they become anxious, and they know what to do if the person refuses care. But that is a lot for one person to carry. And if that one person becomes sick, tired, unavailable, or overwhelmed, everyone else may suddenly realize that they do not know the care plan. That is why the care plan needs to be written down, shared, and updated. So, what should be in it? First, the daily routine. Write down the usual flow of the day. What time does the person usually wake up, have meals, rest, bathe? What time of day is usually harder for them? A routine does not have to be rigid, but it gives the caregivers a guide and it helps to reduce guesswork. New helpers and family members can then step in with less confusion. Second component of the care plan is medications and appointments. It must include the medication list, doses, times, allergies, doctor information, pharmacy information, and upcoming appointments. This information should not be hidden in one person's phone or memory. In an emergency, the family should be able to find it quickly. Medication mistakes can happen when people are tired or when information is scattered, so keep it simple, keep it updated, and make sure at least one other trusted person knows where to find it. The third thing in a care plan is personal care needs. This includes bathing, dressing, toileting, grooming, eating, drinking, skincare, and mobility. This should tell us if the person needs help getting in and out of bed, where they need supervision, where they need reminders, for example, reminders to drink, whether they have idiosyncrasies like coughing when eating, do they need help with changing clothes, do they resist bathing, and how do we deal with that, and many other things about the personal care of the person, where the details will matter. These details help to protect the dignity and safety of the person that is being cared for. The fourth component of every dementia care plan should be consideration of the safety risks. Looking at falls, looking at wandering, looking at things like unsafe cooking, what their medication risks are, any issues with bathroom safety, problems with nighttime confusion, if there are swallowing concerns, skin concerns, including pressure sores, and any risk of them leaving the home unsafely. We need to ask where are the danger points in the house, what are the safety issues that have happened before or nearly happened, what is becoming more difficult now in terms of safety, and this planning should not wait until crisis. If walking is less safe now, the walking aid needs to be reviewed, the bedroom and the path through the house. And if the person wanders, we need to review our door safety, the amount of supervision that is needed, whether or not the person is equipped with things like ID, what their routines are, and what the family will do if they go missing. The fifth issue would be communication and calming strategies. The plan should say what helps the person feel calm. For example, do they respond to a gentle voice? Do they need you to give one instruction at a time? Do you need to give them time to answer? Do they become upset when there's too much talking or too much stimulation in the room? And what calms them? Is it music, prayer, quiet, a familiar object, a short walk? and write down what tends to upset them. Is it things like too much noise, being rushed, arguing with them, or correcting them, telling them that they're wrong, or being surprised by new people? These are not small details, and they can make the difference between a calm day with the person and a very difficult one. The six components of any good care plan is about roles and responsibilities. A good care plan should answer who gives medication, handles appointments, buys groceries, pays the bills, covers the night shift, who sits with the person if the main caregiver needs rest, who should be called in an emergency, and who can make decisions if something urgent happens. This part can be very uncomfortable, but it is important. If family members want to help, the plan should make it clear how they can help. Concern should become a task, a shift, or a contribution. The seventh and final component is the backup plan. What happens if the main caregiver gets sick? What happens if the helper does not come? What happens if the person falls? What happens if there's a sudden increase in confusion, fever, a new weakness, chest pain, or severe behavior change? Who is called first? Where is the medication list? Where is the ID? Which hospital or doctor should be contacted? A backup plan helps the family to act faster when emotions are high. Finally, the plan has to be updated. A dementia care plan is not something you can write once and forget. The person's needs may change, the caregiver's energy may change, the home itself may need changes, family support may change, and so the care plan needs to change as well. So here is the main point. A good dementia care plan should be practical, shared, and updated. It should not live only in one caregiver's head. Care Caribbean offers caregiver consultations and dementia care planning to help Caribbean families think through the daily routines, risks, support, needs, family roles, and next steps in a practical way. This is not about blaming the caregiver, it is about making the plan clearer, safer, and easier to share. Join Care Caribbean for caregiver support, support group updates, practical tools, and care planning guidance. It's free to join, and we can take it one calm step at a time.